In terms of the breast cancer burden, you also see great differences across the countries. And the late-stage presentation is quite important in Ghana, not as much in Costa Rica and in Jordan. We have also done an analysis through a survey that we sent to the countries about their capacity for program and policy development. And this table is showing a summary of what we found in the different countries. All of them are working in national cancer control policies and plans. Costa Rica has one already official one, and the other two countries are working in national cancer control program policies and plans. They have a national cancer focal point in all of the countries, which is quite important to have a leader based in the Ministry of Health that will be able to lead the process and liaise with the other sectors to be able to push for the policies. In the case of breast cancer, the early detection is quite well established in Costa Rica. Jordan has started already 5 years ago to work in a breast cancer program, and Ghana is just starting to look into this with a more public health perspective. But there are big questions across the countries, and this is what the cost-effectiveness study is going to try to solve, which are going to be the best priorities for those countries having such a wide variety of socioeconomic and health system situation. In terms of resources, all countries say that they have limited resources to try to address their problem. Of course, it's much more limited in Ghana because they have lots of other competing problems. They have no cancer registries in Ghana, and the data then is quite limited, and there are problems to collect the data. In the other countries, we have cancer registries, and there's much more availability of data to analyze the information. The health insurance in Ghana is not covering all the cancer services. It could eventually in the future if we have the right policies and the right priorities to be addressed and included in the health insurance scheme. In the case of Jordan, the government covers treatment, but it doesn't cover the first part, early diagnosis and diagnosis. And in the case of Costa Rica, there are universal coverage. So this is a very brief summary of what we have done in the survey. When we go to the countries and we visit the countries, we get much more information and we collect much more details to be able to advance and facilitate the policy process. So finally, just to say that we are looking into, for the first time, maybe in WHO, in cost effectiveness analysis done at the country level for a specific cancer, like breast cancer. This is a very important project for us in WHO, and we are thankful to all that have contributed, all our partners, especially Komen Foundation, that is funding the project. Now my colleague is going to look into the analysis, results of the analysis of the cost effectiveness study, and probably he's going also to let you know a little bit about the affordability issues that are also part of this project. So, Lawrence, please.